Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzo.
And I'm Dr. Brad Weaning.
We've got an interesting topic today.
Yes.
If you have had a joint replacement,
Yep.
you may be wondering, okay, when can I have the other side done?
Because you're so excited.
You just love it so much, you want to get the other side. Or even before you book one, you're like, well, both my knees bug me, both my hips bug me, both my shoulders bug me.
Book it.
When can I book the next thing? Book it, Dano.
Yeah.
So
there's a wide variety of reasons and philosophies on this. Our philosophy is about 3 months, Paul.
I usually say 3 months too, yeah. Some people do them at the same time,
Yes.
both two sides at the same time.
Yep.
We have a video on that.
Yep. There are some pros and cons, and we feel that in general that's not the right approach for us.
Yeah, but check out that video if you want to know more about having both your joints replaced at the same time. But in our case, we usually say 3 months. What's so special about 3 months? Why do we say 3 months?
I always thought it was 2 orthopedic units, because an orthopedic unit when residency was, everything was 6 weeks. That was 6 weeks, this, 6 weeks, this.
Yeah.
So I thought it was 2 times 6 weeks.
That's pretty much it. I think, I like to say the magic number is 6.
Okay.
You got to get to the OR within 6 hours for an open fracture, 6 weeks, residency plus fellowship, 6 years.
Yep, okay.
Same idea. So we say 3 months because that's kind of when you're recovered enough from one side to take the load that's going to have to take when you do the other side, okay? Because you're going to be using one leg way more than the other right after surgery. So that gives you sort of enough time to recover.
Also gives you some time to forget the trauma. I think sometimes it's a stressful, difficult experience, and difficult for your family, difficult for you. You know, it's a lot to ask. So a lot of people require that time, I agree, to fully recover, just to get to the place where they're ready to think about it.
And the other reason I like the 3 month is because it gives you time to change your mind. Sometimes when you do one side, your other side feels better, right? Because if you had 2 bad sides and now you have 1 good side, you can sort of put more weight on that side and it takes a break off the other side.
Right.
So I feel like 3 months, maybe by the time that time comes, you're like, hey, you know what? I feel better. I don't think I need this one done now.
Yes, you might be able to delay the operation that you thought was inevitable. Yeah. I would agree. I would totally agree with that. Another thing for me is your blood count. So when you have surgery, particularly bigger orthopedic surgery, you do lose some blood, and it takes about 8 weeks for our bodies to make that blood and restore it back to where it was before. So that helps reduce your risk of things like heart attack and stroke and other stress on your body. So a little past a couple of months allows your blood count to recover. So for me, that's a big part of it.
Okay, so that's a good ballpark. 3 months. Now keep in mind that depending on where you're having your surgery done, the wait list might be so long that you might not be able to get back in 3 months.
That's possible.
But in an ideal situation, if you could get it done 3 months later, I think you're in good shape.
There you go. Now you know the answer. And if you like this video, please like it, subscribe to our channel.
And leave some comments, right? If you had it done more than 3 months, less than 3 months, same side, put them in the comments so other people can learn from your experience because you are in charge of your own health.
We'll see you next time.